This is the next question which you have got. Tell me what is the answer. The questions which we have taken are from the recent topics, recent exams, and they have high chance of appearing again. And what you want is just cross the 50% barrier. Definitely you'll cross it, but to cross the 50% barrier, you must target for 75%. Target for 75%, you'll definitely get 60%, and 60% is good. But if you target for 50%, you know what happens with most of the people. Don't target for 50%. Raise your bar higher. Okay. Yeah, Joy. Yes. Definitely we'll be the winners. Okay. We need good doctors, sincere doctors, skillful doctors. There is deficiency, and we need you people. You are the future. You are our future. So push it hard. Push to the maximum. Analyze yourself. What do you think? Skin receptor responsible for detecting the rapid vibration. Now they're asking rapid vibration. There can be slow vibrations also. Before I mark the answer, let me take you to this diagram, which you should be aware of. And we'll be putting some details now. As you will notice, we are looking at the skin receptors here. And when we are talking about skin receptors, you will start the very first. You can start here. See, in the skin, you will have skin epithelium, epidermis, and then down is dermis. Dermis is thicker and epidermis is thinner. In the epidermis also the basal layer. The basal layer of epidermis, you will have one receptor which has been magnified, and that is magnified here. And you can see that is called as Merkel receptor, Merkel cell Merkel receptor. Basal layer of the skin epithelium, epidermis, you have this receptor number 1. I'll be drawing a diagram, but just look at the region, location. Number 2, I'll be talking about is near to it. That will be the Meissner corpuscle. Meissner corpuscle is at the dermo-epidermal junction. At the dermo-epidermal junction, this is the Meissner corpuscle, number 2. Then number 3, I'll be talking about Pacinian corpuscle. This is the Pacinian. So number 3, we'll talk about Pacinian corpuscle. And number 4, we'll be talking about Ruffini receptor. Number 4, the Ruffini receptor. And once you have this orientation, that these two are in the deep dermis, basically. Let us draw the diagram. As you draw this diagram, you will see that we are basically talking about two things. One is epithelium. That is the skin epithelium, or you can say epidermis, and below that is the bigger region, that is dermis. Dermis also, there will be superficial dermis and deep dermis. So first you have epidermis, then below that is dermis, which is superficial and deep. Now here we are showing at the basal layer of the skin epithelium, the basement, near the basement membrane, is one cell, number 1, and we are calling it as Merkel cell. This is Merkel. And then Merkel cell, you remember, like I'm holding a pencil, it will give me the feeling, sensation of that. So it is light touch sensation. Merkel works for light touch sensation, and it will be giving me sustained light touch, sustained, because it is slowly adapting. It is slowly adapting. So it cannot give me immediate information because slowly adapting. So sustained touch should be there. Then it will be telling me about light touch. This is number 1. Now let us come to number 2. Number 2 is here. And as we are telling the name, it is Meissner corpuscle. Now, as we talk about Meissner corpuscle, it is at the dermo-epidermal junction, and it is also working for light touch, but it is rapidly adapting. So it is rapidly adapting, and it is Meissner corpuscle, and it has certain function. Like one thing it does is, it'll take care of fine touch. Fine touch, that is why it is important for tactile discrimination, 2-point discrimination. You know, in the patient's neuro ward, you do 2-point discrimination, tactile discrimination. This is a good receptor to carry 2-point discrimination. It is also working for touch, and it is rapidly adapting. And then you can also understand, the thing is, you have to be careful here when you say it will detect vibration. Not only it is for tactile discrimination, it is detecting the vibration also, but that vibration is not very fast, means some 50 hertz, maybe some 200 hertz, but it will be slow vibration, because for rapid vibration you have got here the onion skin appearance, that is the Pacinian. So Pacinian, which is in the deep dermis, this is number 3. Number 3, Pacinian in the deep dermis, and this is detecting P for P, pressure, P for P, Pacinian for pressure and vibration. But this vibration will be high. So rapid vibration, that was our question. Our question was, who will detect the rapid vibration? And that is Pacinian, because the Meissner, though it is rapidly adapting, but then it is detecting slow grade of vibration. Vibration means, that frequency. So that frequency is less, then it will detect the Meissner. Otherwise, frequency is rapid vibration, then will be Pacinian. Then what about number 4? Number 4, as you will notice, we are showing here Ruffini receptor. This is Ruffini, and Ruffini is for the dermal stretch. Dermal stretch means like you are undergoing massage, and massage, dermal stretch, skin stretch. And be careful, this is slowly adapting. So now you have got 2 slowly adapting. Number 1, it was the Merkel, this is slowly adapting. And number 2, it is the Ruffini, which is slowly adapting. 2 slowly adapting and 2 rapidly adapting. What are the 2 rapidly adapting receptors? The Meissner is rapidly adapting and Pacinian is rapidly adapting. In that also, 2 of them are in the deep dermis and 2 of them are, one is in the superficial dermis, one is in the epithelium itself. So these are the 4 names which we wanted to talk about. Let us come back to our question now. And as you are looking at the question, now you will be able to find your answer quickly. What do you think is the answer? Skin receptor, which is responsible for detecting rapid vibration. It will be a rapidly adapting receptor, but which one? Meissner or Pacinian? So it should be Pacinian corpuscle. Now, why did you take your answer as Pacinian? Why not Meissner? Because Meissner works for the slow, or the vibration should be of low frequency, slow frequency or low frequency vibration. Then it will be Meissner. What is the other function of Meissner? Meissner is basically for tactile discrimination, touch, like 2-point discrimination, and it is also detecting vibration, but that vibration should be slow, not the rapid. For rapid detection of vibration, we have Pacinian. Pacinian is the answer. And P for P, so it is P for P, it carries pressure as well as the vibration. And because it is deeply located in the dermis, it is in the deep dermis, so your pressure should be deep, deep pressure, deep vibration. That is why rapidly adapting. What about the Merkel? Merkel we have discussed earlier as well. Merkel, first of all, it is in the basal layer of epithelium, the last layer of epithelium, and it is for light touch sensation, and it is basically slowly adapting. It is slowly adapting, and it is not detecting the vibration at all. Means they can detect, all the receptor can detect everything, but we don't consider this as looking for vibration. It is for light touch sensation, like holding a pen. And what about the Ruffini? Ruffini is in the deep dermis. It is slow adapting. First of all, it is slow adapting. Second, it is in the deep dermis. And third thing, it is for stretch, like skin stretch while you are undergoing the massage. A lot of details are there, a lot of questions are there. They continue coming, but here we'll keep our answer as Pacinian corpuscle.